For this tutorial, we will review the different ways to submit a ticket for a consultation, access to our self-serve tools, or a data request. If you simply have a question for the Research Scientific Facilitators, you can send an email to phdatahelp@umich.edu. This will automatically generate a ticket in our system. Through any browser, you can also type in Dr. UMich, not to get confused with doctor as in a physician. Dr. DOCTR stands for Data Office for Clinical and Translational Research. On their website, you'll be able to see all of their services, as well as a training and consultations link. When you click that link, go to Contact Us, and it will automatically take you to a customer portal. Here you can schedule a consultation or ask a question. If you go back to their customer portal, you have the ability to put in a self-serve tool access request for Data Direct, for example. If you go back to customer portal, you can also put in a custom data request. If you're unable to find the data that you need within the self-serve tools, you're able to customize a data request with an analyst from the data office. Once we have your custom data request, we will assign it to a research scientific facilitator to see the project from initiation to completion. We will then schedule a consultation with the study team and the appropriate analyst if necessary. The data office will do a quick regulatory review of the approved IRB application to make sure what is being asked for has been approved by the IRB. You will then receive a safe data handling attestation to sign. An analyst will then review your request and send a cost estimate to the PI of the study for the work that is being requested. Once the cost estimate has been approved by the PI, the analyst will start working on your request. There might be some back and forth between the analyst and the PI to make sure all pieces of the request are met appropriately. The data will be delivered to the designated storage location assigned by the PI when completing the request.